Hey, so I just got out of my very first dermatologist appointment. I did a full body scan and I wasn't particularly concerned with any, specific spot or mole or anything like that. I'm pretty good, especially now, about scanning my body and keeping an eye out on things and noticing if I see any changes, and I haven't. So I wasn't extremely concerned, but just walking in there knowing that I'm at a higher risk for melanoma, skin cancers, period, kind of put me on edge. The doctor was really cool, Dr. Fox. I have all these doctors with the coolest names, but Dr. Fox was really cool, and she wasn't too concerned with anything. It didn't seem, just because of the BRCA2 and the family history. Like, my mom had skin cancer. She does want to see me in 6 months, but after that she just said, you know what, once a year is plenty, and you obviously take good care of your skin, up your SPF, but that was it. So it went really well.
So I wanted to catch you up on some recent developments with me. I am going back in for revision surgery. I am going to have them take the other nipple. I got to my last appointment with Dr. Ray where we were going to sit down and talk about the final nipple reconstruction. And the more I thought about it, I was just like, why am I not just doing this? I'm concerned that they're not going to be able to get it to match if one nipple is natural and the other is reconstructed. So I broached the subject with him and asked, is this something that you guys have ever done? And he was like, we do this. It's called a revision surgery. So is that what you want to do? I told him, yes, that is what I want to do. I'm not looking forward to the extra surgeries, the extra procedures that it tacks on. But if I was ever going to have a chance to do it, now was the time. So insurance covers it. It's just called a revision surgery, and you're entitled to it. It's so that both sides match, and you're entitled to have both sides match. It's fair. I like that. So I'll be going in for the revision surgery in 3 weeks. I've got another pre-surgery appointment with my main primary care in a week, so I will see her again. So I'll go into detail about the actual revision. What would happen is they would take that nipple and they would have to pop an expander in that side to overexpand it so that it's at least as big as the left side. Now, Dr. Ray said that he was aware that I was a little disappointed with the final outcome after the last implant exchange surgery. And he said that he was getting some new expanders in. They're called suture expanders, but we can do a different style that would create more projection and would thus create a larger appearance. So if we were going to put an expander into the right side because of the nipple revision, nipple surgery, then why don't we just put an expander in the left side and let's redo the expansions into the bigger projection and the shape that I want. It's a pretty good idea. So it feels right to me. I'm scared about going into more surgeries. This means I have to go back under anesthesia a couple more times instead of just one more time. But it's pain right now so that I can have what I want later. I would regret it if I didn't do it. In about 2.5 to 3 months, I will do my final exchange surgery with my final implants, and that will be that. As far as a final nipple reconstruction, so here's where I'm at with that, guys. Every picture that I see of others' reconstructions, I just don't like them. I don't like them. I understand why women want to do that, why it's a sense of normalcy. And I completely understand that, of course. There's so this whole situation is abnormal. And just to get that back, just some sense of normalcy. So I get it. It's not for me. And I think that I'm not going to do a final nipple reconstruction. To be quite honest, I don't mind the appearance of them with just the scars. I don't mind it. Whether I just go blank like they are now with just the scars, just bare skin, or go with an artistic tattoo, which I have been doing a lot of research in that, and some of these tattoos are absolutely beautiful. They're so beautiful. And that could be an opportunity for me to express my my pride at this journey that I've gone through. And that could be an opportunity for me to express my artistic side. I haven't decided whether I'm going to do tattoos or not. But I'm about 90% sure it's going to be one of those instead of a nipple reconstruction. So that's where I'm at with everything. I'm beyond the point of asking if this is normal and if how I'm reacting to the situation is normal. I don't care anymore. I've told 3 people about my ideas, my idea about doing the tattoos, about not doing nipple reconstruction, and you would think I told them that I had just hit their dog. Number one, it's not really their, their problem. Like it's not theirs to be clutching their pearls about. Even though, yes, I did tell them, I voluntarily gave that information, but I was looking for support. But when all is said and done, I'm the one that has to live with this body. And I'm the one who has to live with the decision. And I've got to make the decision that feels right to me. Hey y'all. Heading to see Dr. Dick this morning. Dr. Dick. Yeah. I'm 2 weeks out from the revision surgery. So I've got to go in this morning to see Dr. Dick for a pre-op. It's got to happen every time I got to go in for surgery. Got to go get some blood work done. And I'm not sure what's on the orders for today, if this is going to be any different than last time, but there may be x-rays as well because I didn't have to do that last time. But I did for the original surgery. So I'll let you know how that goes and what we do. And I'm sure it will all be great. Hey, so I'm in Dr. Dick's office and I just got finished with the examination. She's sending somebody in right now to do the blood work, and then I am all set. And it was really quick this time, just like 10 minutes. But yeah, I'm all done. So now we just wait 2 weeks to surgery day. Tomorrow is the revision surgery, bright and early in the morning. My nerves are a little frazzled. I'm a lot more afraid than I thought it was going to be. This just does not get any easier. Like you would think it would get easier. Three surgeries in, and it doesn't. I'm a big baby. But yeah, we're doing the revision tomorrow. They're taking the nipple off. I'm gonna stop saying that they're taking the nipple because that makes it sound very like Machiavellian, and they're, stealing away into the night with my nipple, and they're just taking it off. And popping the suture tab expanders in. So I guess I will see you all on the other side. Ugh, wish me luck.